Hello, everybody. Welcome to Vision Health Pioneers Demo Day. We are super happy to have you because we have an exceptionally great program for you tonight. You're going to be seeing some amazing startups present what they've been working on throughout these last 9 months or so. But before we do that, I'll introduce myself. Otherwise, you won't know whose beard you're looking at for the rest of the evening. So my name's Justin Horsall. I'm the founder of Record Once, which is a startup that allows you to record video material of your software. And that video material then automatically updates every time you update your software. So I'm going to be the host of tonight's event, and I'm going to guide you through this amazing program. And a lot of the startups that you'll see here tonight, actually all of the startups that you see here tonight, are part of the Vision Health Pioneers Incubator program. And that's a program that is publicly funded. It's funded by the Senate of Berlin and the European Social Fund. And together, they've invested more than 1.5 million euros in the development of healthcare solutions that support patients and medical professionals in Berlin, in Germany, and beyond. And Vision Health Pioneers is located in Berlin and the Berlin-Brandenburg region, and that's not random. There's a good reason for that, and that's because Berlin is a true healthcare hub. It contains more than 21,000 companies, some of them really, really big, like Bayer, Pfizer, Berlin Chemie, and some of them more up and coming, like Ada Health and Clue, and there's some networks as well in Berlin, like Flying Health, Heartbeat Labs, and some health innovation hubs as well. And together, all of these different companies and institutions contain more than 360,000 healthcare employees. So, oh, and on top of all of that, there's also the largest university hospital in Europe, which is located in that region as well. It's called Charité. So there's a good reason why Berlin was chosen for Vision Health Pioneers. And Vision Health Pioneers is, of course, especially happy to support healthcare innovation in times like these where it's really, really needed. And we have to do it very quickly as well. And they support the teams with equity-free funding of up to 72,000 euros, free co-working, mentoring, and a training program of about 9 months as well. Or at least it was going to be 9 months for the first batch, and due to Corona, it's been extended a little bit to 11 months. So they're lucky or not, it kind of depends on how you want to see it. Now, in February, the very first batch of startups was selected, and that was selected among 260, more than 260 entrepreneurs that applied. And eventually, 40 companies got into the shortlist, and 17 founders and 7 teams were made it through. Now, those applications came in from a lot of different countries, including India, Spain, USA, UK, Poland, Russia, and Italy. In total, there was like 31 different countries where different teams applied from. And it was very, very hard to choose from that short list of 40 companies. Now you're going to see the very best, the cream of the cream, the ones that made it into the incubation program. And among them are, as I said, 19 founders, 11 of them female, 8 of them male, and from 10 different nationalities. So nice little mix there. Now, all of these founders are early stage. They haven't been working on their ideas for years and years and years. They're quite early, and we've been helping them a lot, and you'll see the results of that soon. Now, they took this leap to work on their company and work on healthcare innovation full-time in March of 2020, which is pretty much the most unpredictable time that you can choose to do that. And so we're very happy that they did it regardless. And this incubator is the brainchild of 3 people that have been active in the Berlin healthcare startup community for a very long time. You'll know them probably. Their names are Joscha Hofferbert, Micah Henningsen, and Maren Lescher. And then last December, Lucy Avalanche joined as program manager, and in the past couple of months, some other team members joined as well. Gemma McCreesh, Karen Paul, Margaret Wolf, Ella Lapkowska, and they've been supporting these 7 teams on their rocky path. Now, these last couple of months, looking back on it, it really kind of they're proof that an idea and a vision together can really turn into reality. Now let's take a look at these last 9 months or so.
The best thing that I could say about Vision Health Pioneers is definitely the constant support. I mean, we are already in this crazy roller coaster. So I felt like as an entrepreneur, I never felt alone.
It was so great to have that variety of mentors. So we had people from a more financial perspective, but also from the healthcare industry that really helped us to push things forward.
Sometimes it feels like you don't have time to listen to another lecture because there's so many things to do. But after you talk to many people who kind of went this through, you see how much this knowledge is valuable.
Once we have a startup, we are in this constant learning curve. And the fact that we have 2 times a week these amazing mentors teaching all the tiny aspects about building a healthcare startup is just amazing.
I'm really happy to be here in Vision Health Pioneers. We have a big opportunity because we came from the other country and it's our second home.
Co-founders around you that you would meet just while making a coffee or going for lunch. You're never alone, so we all share the same challenges, and on the other side you have the team that give you the support that you need. They will get you the right mentors and get you through this hard time.
It was amazing to work with the different teams and tackle challenges together. We learned so much from each other.
Everyone is so supportive, from the mentors to the other co-founders of the other teams.
You work with people that really want to change the world. Startup and technology is a mean or kind of vehicle to really make a big change.
What a great little recap of the last 9 months or so. Now, you'll see a lot of those faces back throughout this event, and you'll have the opportunity to interact with them as well. You can do that in a couple different ways. There's a Q&A button above my head, and then there's this blue little ask a button over there that you can click on, and you can ask us questions and you can interact with us. So definitely do that. You definitely want to do that, and you'll be able to ask our startup some questions and our first speaker some questions in a little bit as well. Now, you can also post and tweet, and that will end up on our social media wall, which is there's a button for it above as well. And you can use hashtag Vision Health Pioneers and Vision into Reality to be able to end up on that wall. So definitely take the opportunity to do that. And last, but definitely probably the most important way that you can interact with us today is you can actually book a 15-minute conversation with all of the people on this stream, or at least the startups. And you can do that by clicking on this little ball in the bottom right, and you'll see some faces change every so often. You can click on that and you can schedule a 15-minute one-on-one conversation between you and the startup tonight actually. So definitely do that. Click on it already, see what some of the features are, and get familiar with it. And don't forget the ask button that I talked about, because you're going to be using it in 2 minutes or so. So for our first conversation for tonight, before our startups present, I actually have the privilege of talking to the amazing Keith Grimes. Keith has a lot of great startup advice. He's the medical director at Babylon Health. He's an NHS general practitioner with nearly 20 years of experience on the front line of primary care. He's the founder of VR Doctors, which is an online forum supporting the immersive health tech community. And Keith is a keen advocate of the power of technology to improve quality of life globally. He's delivered award-winning digital medicine projects, as well as pioneering work in clinical VR and artificial intelligence. And he leads the Babylon Clinical AI Fellow Program. Keith, welcome.
Hello, thank you very much for having me. Hello there, Berlin.
It's an absolute pleasure to have you, Keith. Now, Keith, first question, in your own words, what do you do at Babylon Health?
Great. Well, look, my job at Babylon Health, my title at Babylon Health formally is the Clinical Digital Health and Innovation Director. And my role in Babylon is very simple. It's to lead up the digital doctors that work in the company that help build the products that power the services that we provide, not only in the UK, but around the world, in Asia Pacific and in America too, and also in Africa with Babel in Rwanda. So I've been very fortunate to work there for the last 2.5 years, and I'm one of the senior doctors working with a team of about 25 doctors here in the UK and more doctors internationally.
So can you tell us a little bit about your journey? Is it true that you wanted to make computer games and you ended up becoming a doctor?
Yeah, absolutely right. I wanted, when I started at medical school back in 1990, my first choice was to go and learn how to write computer games because I was and still am a massive computer gaming fan. But of course, I came from a family of engineers and I did quite well at school, and they refused to let me do something as frivolous as writing computer games. And I was able to pursue my second passion at the time, which was medicine. Even then, I went to medical school back in early 1990. I was still really keen to try and use technology to improve patient care. Now, of course, back in the early 90s, this was really pre-mass adoption of the internet as well. So I was fortunate enough to see the internet become adopted in the mid-90s and then become more popularly used later on. And so I was constantly trying to find a way to use technology in my work and with my patients. And it's something that I think, in common with a lot of people who went through the same path as me, I faced barriers again and again and again, all the way through. And here we are now in 2020, having to deal with COVID and seeing a real explosion in the acceptance of digital health. So whilst it may seem to many that it's come very, very quickly, I've spent 30 years looking for a way into this. But you're right, it started with trying to get into computer games, which I failed at, I'm afraid.
And let's talk about some of these setbacks that you talked about, or some of these barriers. What do you feel about them looking back on your journey?
Yeah, I mean, the important thing about facing any barriers is that if you want to try and achieve change, if you want to try and achieve something truly different, you are inevitably going to face resistance. You are inevitably going to face problems, and you're inevitably going to have to deal with failure along the way, because you are not going to have the one genius idea that changes the world. At least very few people are, from the very start. So it's really, really important that when I look back at the work that I've done along the way, two things have motivated me. One is this sort of passion for technology, knowing how it changed my life along the way, and wanting to try and find a way to bring that into healthcare. And then the second thing is making sure that whenever you come up against any of these barriers, that if you are ultimately going to struggle to overcome them, it's important to try and draw as much as you can in terms of learning lessons from that time. And so with each of the problems that I've had along the way, and there's been many, principally within the National Health Service, and the National Health Service in the UK is a very large organization that is beginning to have some changes now, but is famously resistant to change and innovation up until now. It's important to try and identify these things, because it then allows you to sort of find the next way forward.
And when you bump up to these barriers, and sometimes like you'll actually try something and it won't work, it will fail. How do you get self-doubt, or how do you deal with that?
Yeah, well, there's a lot of emotions that come along with this as well. And I'm sure people, some of the startups here will have gone through this right now. And the first thing to say is it's entirely okay and normal to feel frustrated and feel as though you have this one idea that all you need to do is try and convince people. Now, there's a few things that I've observed along the way. And the first is that resistance to change is a universal, regardless of where you are. And in some ways, it kind of doesn't matter what evidence you bring to the party. A really common thing that happens is that as I went along and I tried to introduce some new technological innovations. So a good example for this would be the use of video consultations back in 2013. I was trying to bring this into my practice. And I was just told, oh, no, that's you can't do this. because it is medico-legally, it's not possible. You're not allowed to do this, so you shouldn't do it. And so I thought, well, maybe I shouldn't do this. But then I checked with my insurer. That as a doctor, you have medical legal insurance. And with a little bit of pressure, I found out that actually, no, there were no barriers at all. These were my patients. I had access to their notes. And if I was doing this in a consenting way, it was fine to go forward. So I went back to my company and said, well, it isn't illegal for me to do this. It's fine. My insurer says this is okay. At which point they said, but where's the medical evidence? Where is the evidence that this new thing that you're doing, where's the randomized controlled trial that this new thing that you're doing is going to help your patients? And of course, getting a randomized controlled trial together is an expensive and costly process. So at that point, I thought, well, I don't have the evidence for this. The thing is, I then went into commissioning care, and then I found out at the other time that we have people coming to us saying, well, I've got this trial. And at that point, they say, yes, but that trial is not perfect for this bit. So the observation that I've made is that the fundamental thing that you have to address is this resistance to change. And you have to try and work with people to try and move with it. And for me, the key to achieving change was to identify champions, particularly clinical champions if you're working in healthcare, and also patient champions. If you can find those people who are willing to bring their energy to the work that you're doing, then you stand a much greater chance of success.
And so kind of like entrepreneur life, and what it's like to be a doctor. What's more exciting? What do you think of these two sides?
Different kind of excitement. So when you're working as a doctor, the excitement that you feel is generally a sense of dread or anxiety, because you're obviously dealing with some very, very serious issues. People sometimes who are very sick and so on. And the other thing that came with the kind of excitement of being a doctor, and it's something that actually eventually burnt me out. I had to take time out. I became depressed as a result of this. Is that you're constantly either want to do something, or you are able to do something, but you're being restricted from doing so because of the amount of time or the amount of resource. So there's this constant compromise, which makes, you're constantly having to safely compromise to get through the day. And that's very hard. So exciting, but in a very anxiety-provoking way. Now, being involved in a startup space is a whole different energy, partly because you're not holding that life or death decisions that you do in clinical practice, which is nice. And actually what that then means is you start to feel a little bit more, realistic about the challenges that you face, because you're dealing with a company and trying to grow it and scale it and deliver a safe service or a good service. But it's not dealing with the life or death decisions that you have just there. And then the second thing that's lovely about it is the community. The community of people that work in the startup space, the community of people that work as entrepreneurs, and the variety of backgrounds that you get is really stimulating. And it's something that I've really enjoyed. Coming to Babylon, I've met some absolutely brilliant people and learned, as much in the last 2.5 years as I had in 10 years previously.
And you've been doing a lot with VR. How did you get into that?
Well, so let me just first of all say that when I first got into virtual reality back in the early 90s, because remember I was saying about computer games? Well, yes. Of course, yeah. So the first sort of round of virtual reality was in the early 90s, and around about the time of the work of William Gibson and Neuromancer, and then there was some arcade quality or arcade units that you could do, and everyone got very interested in this sort of rise of cyberspace and alternative culture. But the technology was awful. The technology was really awful, and so I fell in love with the idea, but the reality of it made me feel very ill. And so it took a long time for technology to get round to the point that actually was comfortable to wear. And that was around about 2012, 2013 when Oculus Rift came out. And between 2012 and 2014, when I started to get my first headsets, I was able to come back into the world of VR. And at that point, a lot of the problems that made people feel uncomfortable or feel nauseated had all changed. So I was using it principally for entertainment, for my own entertainment, for gaming, for looking at this. But at the same time, I was also aware that scientists had been using virtual reality since the early 90s for reducing pain with patients. And so I had this gaming technology, and of course, I've got my Oculus Quest right here, but I had a Samsung Gear VR. So I had this in the practice, and I knew about how it was used in the background, by people for burn care. And then as a doctor, I had my own patients. who had pain problems. And in this particular case, these were patients who had wounds that needed cleaning and care. And it's very, very painful to have this done. And it's actually quite difficult to control their pain. So I had a VR headset. I knew that people had succeeded with virtual reality in reducing pain, and I had patients with pain. And it was a very short step for me to speak to those first patients and say, would you like to try this the next time that you had any, wound care? And I was really astounded by how much pain was reduced by this.
Wow.
That's what started me with VR doctors. That's what started me using it. And I used it on several hundred patients in the end before I sort of stepped more into this practice. And it massively reduced their pain, So I was at the point before I joined Babylon of trying to find a way to scale that. But of course, joined Babylon, and I've seen other people take up the cause, such as good friends like Farhan Amin, working with pulmonary rehabilitation and virtual reality, the work of people like Brennan Spiegel in the United States with his new book VRX, talking about how he uses VR for pain relief, and all the different forms out there. Many, many different people succeeding with virtual reality now too. So it's been really wonderful to see that happening. And it was wonderful to see it sort of born from that at the start. It was consumer technology that we could use for healthcare.
And you said, like you said, you started VR Doctors, which is a community for doctors using VR. I'm curious what kind of stories have popped up from that.
Yeah, sure. Oh, well, there's loads and loads. I mean, it's been interesting to see early on, a lot of the first use of virtual reality was actually in things like digital reminiscence therapy. So digital reminiscence therapy is where people will use virtual reality for older patients or patients with cognitive impairment, and it will allow them to, if they're stuck in a care home and they're unable to travel, to be able to go to a familiar setting. So I started to see people using virtual reality for their elderly relatives in care homes, and then reducing that kind of agitation and distress, and then becoming calm and singing. So we got this great video footage of people, using it to reduce that side of things. And then we started to hear stories about women giving birth and using virtual reality for pain relief.
Wow.
My friend Farhan got in touch with me. He was a general practitioner in the north of England who realized that you could do pulmonary rehabilitation, which is lung training for people with lung disease. It's often given face to face, but with VR, you can have a person go into a space and do virtual reality guided pulmonary rehab. And he's been working on this for a few years. It's now actually being used within the NHS and has been awarded a prize for a local innovations in that area. So over the last 5 years or so, it's made some big changes. And the final thing about VR that I've seen come up from this is from the area, some of the members have then gone on to use VR for simulation. So for training on different medical procedures and so on. That's quite a popular area just now.
Yes. Yeah.
And particularly with COVID, as people are trying to get medical training and they can't travel, a company called Verti, who I met through VR Doctors as well, is now helping train people to work in intensive care units for ventilation.
Oh wow, that's amazing, and allows us to do things that are just impossible now with COVID and
or very much harder to do at scale. Yes.
Yeah, for sure. And do you have any advice for the young startups that are in this cohort or watching this?
Well, the first bit of advice I would give is that I wish I'd actually been able to join you when I was your age, because when I went to medical school, I came out of medical school at the age of 23 and then dropped straight into this kind of conveyor belt that doctors have, because there's very little in the way of entrepreneurship within medicine. At least there wasn't, and equally with digital health. So the first thing to say is that I'm very jealous that you get to do this as well. This is a wonderful opportunity for you to make a really, really meaningful difference to people who are sometimes marginalized as well. Digital health is a great way of reaching out to people that might otherwise not be able to get care. I'd encourage people, particularly if you're working in healthcare, to find the problem first and foremost. It's very, very tempting sometimes to lead with a solution. I like my gadgets. I've got thousands of solutions sitting around in this room. I've got a 3D printer just there, but it's really, really important to get a very, very good understanding of the problem and the people that experience it. It could be you that has this. And because the world of the startup is tough, you are going to need to understand that problem very, very intimately and be motivated by it for a long time. So my advice would be, really understand that problem. And in some of the run up to today, I'd had a look at some of the teams that you have here as well. They've clearly had experience of that real world problem. So if you've had experience, that's fantastic. Otherwise, there's lots of doctors and nurses out there that can help.
That's some wise words from you, Keith. Thank you so much for that. And yeah, thank you for sharing tonight, giving your advice and guiding you a little bit through your story, guiding us a little bit through your story. That's what I should say.
That's absolutely my pleasure. Thank you very much for inviting me along. And you can follow me on Twitter at Keith Grimes. And if you feel so motivated, you can even sponsor this fine moustache, which we're doing for November. We know you, sir, have had this fine beard for a while, but I'm only rocking this for a month. So if you feel motivated, I'd be very happy for you to visit Twitter and say so.
Do that. Go to Twitter at Keith Grimes.
Pinned tweet. Yeah.
Excellent. And use the hashtags that we're using for this event as well. Why not? Just double it up. So thanks again, Keith. Now, Keith isn't the only fellow entrepreneur that's inspired and that is supporting Vision Health Pioneers. We've actually had over 70 coaches and mentors help out in the past year, and they've been supporting this for a first cohort in the incubator. We've reached out to a few of the mentors and asked them to leave a little message for our demo day startups.
Dear teams, what an amazing couple of months. I can't believe it's almost over. I'm wishing you a lot of success for your pitches and for the big journey ahead. All fingers crossed. See you soon. Bye-bye.
Hi guys. For the next step, I wish you all the best and stay calm and carry on.
Hello. It was a great pleasure working with you, and today you have the opportunity to present your results to a greater audience. We at Berlin Partner wish you good luck for the pitches.
Dear Vision Health Pioneers, I'm very much looking forward to seeing the pitches today, and I wish you the best of luck for tonight, but also for everything that will follow.
It was a fantastic adventure also for me. It was an inspiring journey. Well done. Good luck today.
Hello teams, this is Barbara speaking. Now you are at the end of the program. This is super wow. I remember the very first time we met before Corona in the kitchen with coffee and cake. And now you made so many steps ahead and the next steps are coming. And for this, I wish you all the best, good luck and fun, and let's stay in contact. See you soon. Bye-bye.
Hey guys, I wish you all the best for your pitches. And thanks a lot for your great contribution and passion during those exciting times. Keep up with your great work and stay in touch.
Hi everyone, you've come so far along this journey, you've learned so much. So use this pitch as the tip of the iceberg. Showcase the best side of your business and have lots of fun. Good luck.
Congratulations everyone for all the hard work you've put in the last few months, and good luck today on Demo Day.
Hi, I hope you're enjoying Demo Day. Good luck to all of you for your pitches and all the best for your product launches later on.
Hi Vision Health Pioneers. It has been a great journey for you all in this incubation program in the last months. I wish you all a wonderful demo day, and please make this world a healthier and a safer place for everyone. Thank you.
Thank you so much for those words of encouragement, mentors. You've really been such a huge help throughout this incubation period. And a fun fact, there was a Slack group with the mentors and some of the startups in it, or all of the startups in it, and they've been exchanging some messages, quite a few actually, more than 73,000 messages that have been exchanged between the mentors and the teams. Some kind of props to some of the people, including David Schaaf. He was the mentor that was the most active, and then the most communicative founder was Martina Viaduca from Team Advocent. So well done to you both, and also to all of the mentors that helped out. You were really invaluable. Now, on to the fun part of tonight. In a few minutes, the teams will join us and we'll get our first pitch. And don't forget to ask some questions. Ask them some questions about their pitch, about their company, about the things that you're wondering. Do that, click the ask button down below. It's that blue button, or click on Q&A above and ask your questions. And the teams will get 4 minutes to pitch, 4 minutes sharp. I'm going to be strict. And then 4 minutes for questions where I'll be asking questions, but well, really, you'll be asking questions. So go ahead, click that ask button. And so let's look at the first team, shall we? So first team is hers. And the team members are Linda, Yair, Hugo, and they'll be joining us on the virtual stage. They'll present their femtech solution that they've developed over the past months. Linda and Yair, the stage is yours. Welcome.
Hi, Justin. Hi,
Hello.
Justin. Can you hear us? Thanks
we can
a
hear
lot.
you perfectly. The stage is yours. Enjoy.
Thank you very much, Justin. We are very honored to be the first ones, and I would say we are just jumping into it.
Yeah. So I'm Yair, the CEO of Hertz. This is me 3 years ago while I was working with a gynecologist developing medical devices for pelvic floor dysfunction. One day, my mom approached me and said, Yair, maybe now you can help me with my problem. What started as a bit of uncomfortable conversation with my mother is the beginning of hers.
Yair's mother is suffering from pelvic floor dysfunction, a problem that every second woman will experience during her lifetime. That means each one of us knows someone who's affected. Maybe your wife, your mother, your daughter, or maybe even yourself. And if you've never heard about it, it's because of the big taboo and stigma around this topic. After giving birth or in menopause, the pelvic floor is not strong enough anymore to hold the pelvic floor organs, and they will sink down. This leads to discomfort and incontinence.
The best solution for this disease is pessaries, which are silicone devices that support the organs from inside of the vagina. The problem is that while each pelvic floor is unique, they still come in standard sizes, geometrical shapes, and create stress wounds. This makes the treatment unpopular by women and doctors. And this is why we created Hers, a smart connected medical device. The biocompatible silicone goes inside of the vagina and is connected to an electrical pump for inflation. So when it's inside of the vagina, it's holding the sinking organs in the healthy position. But we don't stop there. Not like our competitors, we offer a holistic approach that stops incontinence immediately, but also offer long-term training of the pelvic muscles. So this is Sarah here, who is happy to go back to work after having her first baby. But she's in constant fear of laughing too hard or sneezing and wetting her pants in front of everybody. When Sarah applies our device in the morning, she will get the support she needs. She will get reminders to train her pelvic floor, and in the evening, she will take it out, clean it, and check her improvement in the app.
Sarah is one of 11 million women suffering from pelvic floor dysfunctions in Germany that we can address right now. We will create a whole new market by raising awareness and approaching mothers and women in menopause with a newly designed product that supports incontinence immediately. And we will take over a market share of the traditional pessaries, disposable incontinence products, and pelvic floor surgeries with a total market volume of $11 billion, and take over a share of the rising femtech market with a market potential of $50 billion. Our team is as diverse as it gets. Yair Kira is our CEO with a vast experience in leading R&D projects around the human body. Hugo Silva is our CTO, an industrial designer who founded a 3D printing company and worked in the field of medical devices for many years. Myself, I'm Linda Wonnenberger, the CMO of Hers. I founded my own GmbH 4 years ago, built the first e-commerce platform for femcare products, Kuka by Linda, and also produced and sell my own patented bra, Linda Bra. On our advisory board are two well-known gynecologists, Dr. Karin Bessler, who is the author of the German guidelines for pelvic floor treatments, and Dr. Maike Henningsen, professor for digital health. Our Hers journey started in March. Alongside the awesome Vision Health Incubator, we validated our concept with a functional prototype. We built the foundation of our company with a bulletproof business plan. We're now in the final stage of the Exist application, and we're looking for a pre-seed funding of 300,000 euros.
So remember, a life began in our mother's pelvic floor. Let's take care of it afterwards. Thank you.
And thank you so much for sharing that and working on this problem. It seems really kind of like an underserved market, definitely, for sure. Now, what was this incubation program like for you?
Yeah, it was everything in the last few months. We learned so much because when we started Hugo and me, it was 4 days before the application time that we just had to take our idea into a good application. And since then, we learned so much, both from the teams that we work with our partners, and of course from the mentors.
And do you have a patent for this?
So yeah, we're applying at the moment a patent together with a lawyer. So this will be our most valuable IP.
And when do you plan to start commercializing the product?
So we're planning to August 22.
Yes, that's when we will launch,
yeah.
because seeing that that our device will be a medical product, it also takes some time to develop the product, but also go through certification. So we'll launch in summer 2022.
Perfect. Now, let me see. It seems, I mean, of course, I can't try out one of these products, but it seems like a lot of work to kind of adjust it and inflate the device. How does that work? Do women have to do that every day, or how does it work?
So basically, this is exactly our USP. This is what we're want to bring to the world. So the all insertion of this hard silicone going to be much easier when you just press a button and the device inflate by itself. And now some women will just need it for sports or for some activities. Some will use it every day, and by that wouldn't have to go through a surgery, for example.
And that's really nice. And then it stores the settings as well, right? So you don't have to readjust it every day. Is that correct?
Yeah.
Perfect. So a question from the audience. How do you face the problem of possible bacterial infection due to this device?
So it's very similar to a menstruation cup. It's also made out of silicone. So in the morning, you just apply it and you wear it the whole day. And in the evening, you just wash it, clean it, put it back into the thing that we bring along, and then you can wear it again. So it's easily cleaned. And so therefore, there will not be any infection risk.
Yeah, it's all biocompatible silicone. So it's going through all the standards and certification of a medical device.
And you showed some of the existing competitors already, right? What's your competitive analysis of the competitive landscape? What's that been?
So in general, you just have really outdated pessaries. So they look something like this, and they're very stiff, and they haven't been innovated for decades, basically. And these are the only ones that you can insert and really stop incontinence. That's the direct competitors, and then we have the indirect competitors, like new femtech companies, like for example, LV, who've just raised 30 million euros, but they're only in the training devices. So that means these devices are digital, they're also medical products, but they only train the pelvic floor, and they're not giving the immediate solution. That means you have to train for many, many months, and then maybe you can cure your incontinence, and we can say with our product, we will stop incontinence immediately. That's the big advantage that we will have.
And I'm curious, Yair, what does your mum think about this path that you've pursued now?
So I guess my mom is on the crowd, so probably we could ask her. I think she's very proud. You know, she did her job in investing in me, and now it's my time to invest in her. And it's not just her, so I think she's very happy to know that with this product, we will also can approach half of the women population in the world. So it's a big topic, and I think I'm happy that my mom was so open with me, and I encourage you to talk with your mom about it.
I will after this tonight. I will do that. You've definitely been inspiring me so far, and I think you have a wonderful product. And I want to thank you for sharing your pitch as well. Thank you so much, Team Hers. Now,
Thanks, Justin.
Our next.
Thanks.
Our next. You're welcome. Our next startup is one that you might already know, especially if you were paying attention at Start Berlin or at the Business Angel Club of Berlin and Brandenburg, because they were pitching there quite recently. Their two founders quit their jobs to enroll in this incubator, and it's their first startup experience. And of course, their learning curve has been tremendous throughout the past months. And so let's get ready for the presentation from Anne and Patrick from Team MySkills.
Thank you, Justin, for this lovely introduction. So we start now.
Do it.
Hi.
Good luck.
Yeah, thank you. Hi, we are the founders of MySkills, and my name is Anne. What if millions of mental crises could be prevented? People with a borderline personality disorder cost 20% of the costs of treating mental disorders in Germany. But why? This is Sally, and she has a borderline personality disorder. Sally's main problems are high tension, self-damaging behavior, and suicide attempts. In the next 10 years, Sally will be treated 8 times as an inpatient and will be dropped out of her therapy several times. During this time, Sally will wait for 3 to 9 months for her therapy places, and she will be admitted to acute care units because of a severe mental crisis. Dialectical behavioral therapy is a first choice and has the highest level of evidence in the treatment of people with borderline personality disorder. Today, the DBT offers Sally thick manuals for interactive skills training. It is very complex and Sally has to do a lot of paperwork. Also, the therapist is not available 24/7 and the aftercare is not guaranteed. As a DBT therapist for social professions, I worked for 6 years on a DBT station and saw many of Sally's problems, especially when Sally is on her own. Our advisor, Christian Stiegemeier, the president of the DBT Dachverband, is a great support for us. For more than 2 years, we have created specific solutions to Sally's problems. MySkills is a digital extension of dialectical behavioral therapy.
Hi, my name is Patrick and I have more than 10 years of experience as a UX UI designer. MySkills is a smart companion app that supports Sally in her daily life by placing a personalized therapy toolbox in her pocket. The app currently supports replacing harmful behavior with new healthy strategies. User input and sensor data will assess and predict their emotional states and mental crisis to initiate personalized interventions from currently over 150 skills. This will be followed by personal assessment, reports, and protocols, helping analyze situation to prevent future crises. They can do it alone or together with a therapist. We create a unique user experience and customer bond by developing artificial empathy together with our strong partners, and at the same time, we meet the high requirements of regulation, data security, and evidence. We have already achieved significant improvements. The user data and feedback shows very clearly that our product works and is needed. Of 1.4 million people with a borderline personality disorder, 700,000 are treated every year. Our B2B2C business model is based on the new Digital Healthcare Act, also known as the App on Prescription. Our potential revenue in 5 years is 25 million euros per year. We are planning the listing in the DIGA directory in October 2021. There are only a few apps on the market. All of them have several deficits and disadvantages. MySkills will be the first app as a DIGA that can be prescribed specifically for people with a borderline personality disorder. And borderline personality disorder is only the beginning. We are planning to expand MySkills in Germany to other diagnoses that can be perfectly supported by our solution in the next years. We have many years of experience in the field of e-health services and all relevant areas, in technology, science, psychology, and of course in design. We have influential advisors, mentors, and partners on our side who support us in the development and spread of MySkills. We need 300,000 euros to expand our team and to meet the requirements for the DIGA directory. There are a lot of professionals just waiting to prescribe MySkills. Join us on this journey and help us to prevent millions of mental crises. Thank you very much.
Thank you very much. I really enjoyed that. What was the biggest challenge that you had to conquer in the past 9 months?
Yeah, wow, that's a good question. So we have a lot of challenges. Of course, we are a startup that brings a lot of challenges with it. But I think as many of us in this incubator and also who develop healthcare applications, there are so much difficulties in this healthcare system, dependencies and regulations that we need to tackle. But we have some very nice and good experts on our board that can help us with these hurdles and help us to proceed and fulfill all the requirements. Yeah.
And a question from the audience, they're inquiring about this artificial empathy, and they're wondering what form does it take?
Yeah, sure. So we plan to do this in the future much more in detail. So we collaborate with some universities in the future that we can provide an AI-based technology that can predict emotional states from the text, from the input of the data from the users, and also from the sensor data that we collected. And then we want to achieve that we can predict emotional states, and therefore we want to do much more research and evidence on the space in the next few months and years. And also we want to have some help in this kind of field that we need.
And how do you make sure that the patients use this long term? I mean, like borderline personality disorder doesn't just disappear overnight. Many people have it for life. How do you make sure that people keep using it long term?
Yeah, that's a really good question as well. So what you need to know about this, borderline patients have really often some such high tension and emotional and mental crisis, and that's not only in 1 month, one time, so on a daily basis. So they need help on a daily basis, and if they don't get help, they experience some really bad habits and dysfunctionality behaviors. And we help right there. We have always available apps that provides help in these kind of crisis, and that's a way better, a healthy way to deal with these mental crises on a daily basis.
And since you're aiming for DIGA, one of the audience members wants to know if you can outline your RCT approach for getting accepted.
Yeah, so we want to do a first pilot study. We already have a product and a beta test that shows some significant improvements, as mentioned. And for the next months, we want to do a pilot study that collect the evidence and show the evidence. And with this approach, we will go to the DIGA directory, and as well with the complete study concept behind this. And for more details, we have especially one colleague of us what is specifically for this topic on board, and we can discuss this on a call maybe later if you want.
Perfect, and that's a good reminder for people to book a one-on-one conversation below with the teams. So thank you again, MySkills. That was great. Thank you.
It was a pleasure. Thank you.
Now we're going to go from the brain down below to the gut microbiome, and all of the doctors here will be bored by my lecture about how amazing it is. It's a vast community of trillions of bacteria and fungi, and it majorly influences your metabolism, your body weight, your propensity to illness, your immune system, your appetite, and your mood. And these microbes mostly live in your colon, and they outnumber every other cell in your body put together. And of course, that's why this next team is so important. You'll find out soon enough. Apparently it has something to do with the gut microbiome, or maybe not. And then have I just been talking about this for nothing? You'll find out soon enough. I'd like to welcome Junaid, Isabel, and Emily from Bioticure.
Thanks so much, Justin. That was an excellent introduction. Ladies and gentlemen, did you know only half the cells in your body are human? The other half are bacteria, and they have a huge impact on your quality of life. Hi, I'm Junaid from Bioticure. We're developing cutting-edge products for microbiome health. What's a microbiome? I'll tell you how I learned about it. So this chubby kid on the end is me, and this is my younger brother. And when my brother was 12, a doctor gave him quite harsh antibiotics. And after that, he couldn't have a normal, solid poop for months. And to this day, he's still dealing with the consequences. Lots of people have digestive problems, even if they're not as bad as my brother's. 11 million people in Germany alone suffer from some form of irritable bowel syndrome. Back then, families like mine had no clue what a gut microbiome was and what it had to do with anything. But because of advances in technology, a lot more people know now. Research in this space has exploded. 80% of all research on the gut microbiome was published in only the past 5 years. So from a timing perspective, innovation in microbiome tech now is like innovation in mobile computing and smartphones was a little more than a decade ago. And in a short time, we've discovered that gut health affects far more than just digestion. It plays a key role in many health issues from mood to metabolism, as well as the development of long-term diseases like diabetes and Alzheimer's. At Bioticure, we're developing bold, daring products on the cutting edge of translational research, both acute therapies as well as consumer products. Our first product is a 2-week regimen for introducing good bacteria to your gut and keeping them there. It involves rectal application of probiotics via suppository. Yes, you heard me correctly. That means putting probiotics in your butt. Why? Because the science clearly shows probiotics applied rectally stay in your gut while oral probiotics do not. You're probably thinking, okay, well, this is just a concept, right? Nope. Our small team brought this product from concept to beta in less than 6 months during COVID. 2 important questions. Do people use it? And does it work? The answers are yes and yes. First, the product has already been tested by 28 paying users, and that means we already have revenues. On top of that, we have an average net promoter score of 8 out of 10. Second, we already have some very promising early data. We treated our beta as an open label study and collected over 400 data points on every single user. Our data shows improvement in IBS symptoms such as bloating by up to 37%, with statistically significant improvement across 3 cohorts. We'll do even better in the future with probiotics personalized to each user's gut, a product we plan to roll out in the next year. So that's our first flagship product. Our second product is a bundle of both oral pro and prebiotics, which we developed for daily use after our early users specifically requested because they wanted to continue their gut health journeys with us. And while oral probiotics don't stick around in your gut the way rectal probiotics do, they still help with day-to-day symptoms. As for go-to-market, we're starting off by focusing on the 30 to 50-year-old health-conscious female demographic. Women have digestive issues at twice the rate of men and are more willing to pay out of pocket. The global probiotics market is growing at between 7 and 9% each year. It's one of the fastest growing categories in consumer health and is forecast to be worth more than $50 billion by 2025. If that's what we can accomplish as just a bootstrap team of 3, imagine what we can achieve together. We're looking for investors motivated by our mission who are also aligned with our values of sustainability and empathy. Together, we'll invest in growth and build our science and R&D team. Lastly, we want to say a huge thank you to Vision Health Pioneers and the Berlin Senate. We've accomplished so much thanks to your support, especially during this time of COVID. And I also want to thank all of you for your attention, and I would invite you to engage with us, ask us questions, as well as book one of the sessions afterwards. Thank you very much. Back to you, Justin.
Thank you, Junaid. And yes, I would like to second that. Thank you for all of the questions that you've already sent in for the previous startups. You've been doing a great job. So many questions that we haven't been able to tackle absolutely all of them. So if your question doesn't get answered here today, make sure that you book a one-on-one conversation with one of the teams later on tonight and get your question answered anyway. So, okay, first question, what can I do to test the product? This sounds super promising.
Well, Justin, for you, you can go to our website and join the waiting list, and we'll get back to you very, very shortly. And that goes for the audience as well. If you're interested in trying the product, or if you'd like to know more, just go to our website, www.bioticure.com, and you can find a lot more information there.
One of the questions from the audience is, was there a control group during your study?
So we actually treated it as an open label study, which means that there was no placebo. Also, our users were paying. So I think it would be a bit tricky to give paying users placebos. But that is for sure something that we would plan to do in the next step.
Yeah, that does sound, yes. People would need a very, very deep discount for potentially a product that is just a placebo. One of the questions from the audience is, are your findings studied in, or sorry, are your findings published in a peer-reviewed journal?
Not yet, and although that's definitely next level, and you know, if we are lucky to get the resources and the collaborators, we already have some collaborations with research groups at the Max Delbruck Center, and so if we're lucky enough to move on to those next steps, or rather we are going to move on to those next steps, yeah, we'd be delighted to share our findings.
Maybe it'd be fun to talk a little bit more about the scientific evidence that you mentioned earlier on in your presentation.
Sure. Yeah, so essentially we started looking into rectal application, and we found a handful of studies out of Italy as well as Israel in both mouse models as well as humans. And in enemas, they actually showed significant disease remission rectally as well as colonization, which was much, much higher than what you would find with oral supplementation of probiotics, where it wasn't a significant difference from control.
And so let me see, another question from the audience. Thank you, very great concept. They seem very enthusiastic. How did you decide which bacteria are essential? And are you thinking about individualizing probiotics? And I seem to remember from your presentation, the answer is yes to the last one.
Yeah, so actually it's a great moment to draw attention to our amazing team. We also have my co-founder, who you can see, Isabel, who did a ton of desk research to find the right strains and come up with a formulation. And yes, it's quite important to personalize probiotics in the near future, because there are several different enterotypes, and depending on the makeup of your individual gut microbiome, you could see greater results from one formulation rather than another.
Thank you so much for that. That was great, Bioticure. Yeah, thanks again, and thanks for answering the questions. We even had a couple more that we couldn't get to, unfortunately, but that's life. So book a one-on-one conversation if you asked the question and you weren't able to get to it. We weren't able to get to it, I should say. Now, not all of our teams were from Berlin. Some of them actually had to travel a little bit to become part of this incubator. And the team that traveled probably the longest distance is the next one. They're called My Paramedic, and they're company was originally founded in Belarus, and March of 2020, the team of 4 packed their bags and moved to Berlin to bring their product to life. And these past months, they've been testing very many use cases, and today they're very happy to introduce you to their latest iteration of the My Paramedic solution. I'd like to welcome Dimitri, Ola, and Dennis.
Thank you, Justin. That's true. Okay. Hello, everyone. Thank you for coming. I'm happy to be here and present My Paramedic. My name is Dmitry. Since childhood, I've been trying to help people. This was reflected in my experience in emergency care. I saw how difficult it was for people to recover from heart attack. Sorry. This is Lucas, my patient. He had a heart attack and spent a lot of time to recover from it. But the fear of another heart attack is still presented in his life. Lucas went through the long journey, and he didn't know that rehabilitation and other types of therapy are crucial parts of recovery. It doesn't change your past, but it can help you improve your heart's future. 80% of patients get drug treatment and stay without any rehab. They don't know how to recover from heart attack at home properly. They feel stress. They need support. Only in Germany, 500,000 heart attacks every year. The local healthcare system spent €1 billion to treat such patients. The solution is My Paramedic, the mobile app that provides an individual cardiotherapy and support for patients at home. So, how it works? Users answer a few questions. The app automatically develops a personal recovery plan. The content is based on German National Cardio Guideline that has clinic evidence. Mobile app supports and motivates users during the whole recovery process. We focus on personalization. Our AI assesses patient condition during the whole process. It analyzes their answers and vital signs read from smart wearable devices, like a real doctor usually does. Depending on the result, it automatically adopts the recovery plan to the user's capabilities to achieve better health results. The personal plan represents a multimodal approach. It gives patients the understanding of their disease, show how to restore their physical fitness and reduce stress level. Users don't do all exercises alone. This is Harty, personal digital assistant. He will help users to achieve goals, earn rewards, and get support from other members. We think that therapy doesn't have to be boring. We started testing the core. It was able to detect 75% of situations when physical activity didn't fit users' health capabilities. It's a good point to say the therapy can be intelligent. Doctor will prescribe My Paramedic like pills after heart attack when a person can stay at home. My colleagues and I believe that symbiosis of the medicine with IT is able to make next step towards the evolution. And our mission is to reduce the number of cardiovascular events, and we need help, investments, and partners. Let's change the world together. So, if you have any questions, please feel free to contact us. Thank you for attention. And also, I would like to say thank you so much to the incubator team, mentors, and other teams for their help. Thank you.
Thank you. I have a burning question for you. You moved to Berlin in March. That's pretty much when the first wave hit Berlin. What was it like to move in that time?
Oh, this is a very good question, actually. It was a challenge for us because we had only a few weeks to prepare all documents, get visa, and arrive to Berlin. And I would say that we bought the last train ticket, and we arrived 1 day before or 1 day after when government decided to set restrictions. So we're lucky.
Wow. So if you would have taken your time just a little bit, you would have spent the first bit of it trapped back at home, not at the incubator. Wow. I'm impressed. Was that the biggest challenge that you've had throughout the last 9 months, or have there been other challenges?
Sorry, can you repeat the question?
Oh, yes. So what was the biggest challenge that you had throughout the last 9 months?
Oh, so actually the big challenge was to understand, I would say, how to sell the product. That's because we know how to do that, but we didn't know how to promote it. But now I can say that we know how to do that correct, how to develop business, because here very nice people who shared with us their knowledge and experience.
And you're using some gamification in your app. Can you elaborate a little bit on that?
Yeah, sure. Dennis will answer this question.
Yes, thank you for the question. It is interesting part of our solution. Based on public research and talking with patient, we understood that one of the main reasons why people doesn't finish treatment program is the low level of motivation. That's why we use game approach. It has to solve this problem. For the beginning, we're going to use daily and weekly rewards to encourage people and support level of motivation during the whole program. And how Dmitry mentioned, we believe that treatment doesn't have to be boring. Thank you.
Thank you. And so what's next in your startup journey?
So actually our next plan is to prepare our product for a pilot project. And next year, so actually we already developed our core, and next year we just need to develop content and combine with our core to start beta testing before launching a pilot project.
So what's your go-to-market strategy then? Can you elaborate a little bit on that?
Yeah, sure. So actually next step, as I mentioned, will be to finish development and make beta testing. After that will be pilot project and medical certification. And after that, the product will be available on the market for patients.
And how are you going to promote it?
Yeah, so actually doctor will prescribe our application like pills, and from last year it's possible because new opportunities available on the market like DIGA. So actually digital applications that provide some benefit. So like digital therapy, and doctors prescribe this therapy for patients.
Thank you so much, my paramedic. That was great. Thank you for answering all the questions. And yeah, hope you enjoyed tonight.
Yeah, thank you, Justin.
Thank you.
Now, up next, time for some more female power on the virtual stage. Our next team is actually one of the youngest teams in our incubator, and these three formidable founders, Anna-Katarina, Isabel, and Adelina, are they more than make up for the fact that they're one of the youngest teams. They're actually also one of the most international teams. There's founders with backgrounds with Brazilian background, Portuguese background, and there's Belgian background in there as well. And you'll be able to ask them some questions like you've been doing. You've been doing a great job so far. So I'm going to give Inu Health 4 minutes to pitch, and then we'll have 4 minutes to answer their questions. Inu Health, take it away.
Thank you, Justin, for this lovely introduction. Hi, I'm Isabel, and we are Inu. I would like to talk to you about a disease that affects 1 in 10 women worldwide. It's extremely painful. There is, as of yet, no cure, and it takes on average 10 years to be diagnosed. I'm talking about endometriosis, which is the abnormal growth of cells outside of the uterus. How many of you have heard of this before? I would like to introduce to you my co-founder, Adeline. Adeline was diagnosed 2 years ago after 17 years of pain. She had surgery to remove the cells, and still, the endo came back. Adeline has inspired us, and during our 50 customer interviews, we realized that most of the women had the wish to reconnect with their bodies and manage their endometriosis naturally. So we dove into our mission to empower women with endometriosis to thrive through the disease. Let me introduce to you INU, the personal support for women with endometriosis. We aim to bring down the shame and lower down the barrier to seek specialist advice early and provide them with holistic solutions to reduce the pain. We hope to make women make peace with their bodies. So how does it work? First, we provide a symptom tracker that that looks at the symptoms of endometriosis specifically, and then offers an analysis which can be shared with doctors or partners. Also, we offer a 28 days cognitive behavioral therapy program divided in daily sessions of 15 minutes, which has been clinically proven to increase quality of life. And furthermore, we provide information about anti-inflammatory nutrition, which can help to mitigate endometriosis symptoms.
So the pain out there is big, and there are already small companies trying to solve this. But we innovate by being the first one providing actionable and practical holistic solutions that are backed by science and offering long-term support and relationship. Just like Justin said, although VHP started in March, the adventure at INU started only 4 months ago when these two amazing girls joined me. My name is Katarina, and I myself have over 5 years of experience in the healthcare and startup scene. The core team spans the experience between healthcare, economics, science, and marketing. Now we are backed by women and manpower in the design and technical team. We have a huge supportive network whose expertise goes through finance, medical, menstrual health space, and startup. And in these 4 months of incredible ride, we've made miracles out of limited resources. Now we established several partnerships for the product development, research, and marketing, culminating with collaborations with influencers and other startups. We have already a customer base of 90 women willing to pay for the app, and we can't thank our community enough. They have been a real brand advocate, spreading through social media a lot. And because inspiration, the same as love, grows if shared, we love to involve them in our marketing campaigns as well. From self-love to body positivity to podcasts with entrepreneurs that build their own business despite the disease. So we're aiming to convert 4% of the 2.7 million women that are suffering from endometriosis in Germany by 2023. We are launching our MVP in January 2021, and we have a direct-to-consumer approach with a subscription model of $59.99 per year. After 2 years, we aim to enter DIGA already with a revenue of 1.4 million. We are rise up to the uterus deck. We are looking for 500K of seed funding and also endometriosis clinics to start our research. If you have any questions, please do it now, or look after to the women with the yellow sweater. Thank you.
Thank you very much. Quick question for you. How well is the CBT approach scientifically proven for endometriosis?
So the problem is the topic of endometriosis is underrepresented in the medical and scientific field. When we established a partnership with the University of Melbourne, they tested our CBT program in chronic pelvic pain patients. However, pelvic pain is the main symptom in 90% of women that have endometriosis. So we are aiming to bring this to this niche market, and we tested already in 20 women, and they all perceive the content of our audio CBT as helpful for their pain.
And so you showed some of your the other solutions. How does your solution differ from the others?
So the thing is, there's no solution right now that offers holistic solutions that are backed up by science. So we're going to be the one that is medical certified and enter DIGA. And secondly, they are expensive and they don't offer long-term support. So we are aiming to be the companion of women with endometriosis.
Excellent. Now, so what's next in your startup journey?
So we are launching the MVP by January 2021, and we, for the first 2 years, we want to test the validation of the product and try and go to medical certification class 1. and prepare everything to enter DIGA by 2023. Of course, alongside, we want to raise this awareness of misinformation, break this vicious cycle of misinformation around our menstrual symptoms, so we will have a powerful voice through marketing.
Now, one of our audience members asks what you're going to do with the pre-seed funding that you're asking for.
So it's for hiring and onboarding, for research studies. It's used also for the marketing campaigns to roll the pipeline, and also for the development of the product.
And what's been your biggest challenge throughout the incubation period?
As like you said, we started 4 months ago. So the biggest challenge is how to bring to the next level all of this, this important mission that all of us resonate so much. Definitely, but I also hopefully, even though there's 4 months, we achieved so much, and hopefully it inputs in all of you the spirit of resilience. If you believe in your idea and your mission, just go for it and don't stop. And that's what we did so far. We overcome all the challenges of such a short notice, so I'm happy where we are at.
Yeah, it seems like you're really, really far along for a team that's only been going for 4 months. It's quite incredible, and I'm guessing you must have been somewhat happy to hear that the incubator period was extended due to Corona from 9 months to 11 months, right? Or I don't know. What was your reaction to that?
Oh my God! Yes, I mean, absolutely. I mean, but of course. Unfortunately, due to Corona, that limited us in so many levels. But fortunately, it helped us go along in this project and offers us support for more 2 months. But we are happy for it.
Well, thank you so much, and thank you for sharing and answering the questions. Now, we only have one startup left, really. It's kind of sad. It's kind of sad. We've already seen so many great startups. Well, the final startup for tonight, final pitch, is going to be done by Ines and Jonas from Mila Health. Their goal is to change the perception of mental health in the workspace, I should say. And of course, big reminder to book your one-on-one chats with the different teams. You can do that below. I've said it many times, but just in case you need a reminder, or maybe you're tuning in a little bit later on, make sure you book those one-on-one chats for 15 minutes. We're going to stay online until 9 p.m. Berlin time, and you'll be chatting with them. So that'll be great. Now let's give one big last applause to Mila Health. Of course, since this is a virtual event, they won't hear you, but it doesn't matter. It's the gesture that counts. Mila Health, take it away.
Yeah, thank you so much for the introduction. I'm Jonas, one of the founders of Mila Health, and we are the safe space for mental health in the workplace. We make it completely normal to talk about our mental well-being and to work on it in a proactive and preventive way. So we have this strong belief that mental well-being benefits will be a must-have for tomorrow's workplace, just as fitness benefits are already today. Why is that the case? So basically 2 points. First of all, awareness has increased massively during the last couple of years, and it was even kind of accelerated during the current pandemic. Second, employers are more and more suffering from poor mental health of their workforce. So absences due to mental health have been increased by over 300% during the last couple of years. What are we actually doing about it? So we are supporting innovative companies in building a happy and productive workforce by providing personalized mental health support. So personalized mental health support, what does that actually mean? So our core product consists of 3 parts: personalized mental assessment, Mila sessions, and self-guided programs and tools. So the personal assessment, we assess each employee's needs, what are current challenges the employee is facing, could be work-related, could be private, what are personal preferences, what are goals you want to achieve with working with Mila. And based on all those information, we are providing the right support. The support could be in form of Mila sessions, which are one-on-one sessions with a psychologist. So we have a broad pool of psychologists with different fields of expertise, languages, ages, and dependent on what are your personal challenges and preferences, we match you with the right person. And on top of that, we have a lot of digital content, training programs, and smaller tools, from things like meditation, breath work, to more in-depth trainings like to deal with anxiety or to work on your stress. And yeah, I would throw the ball now to my co-founder Ines.
Thank you, Jonas. So currently we're working with innovative companies in Germany. So examples are, for example, Wayfair, Westwing, or Freeletics. And as you can see from the quotes, the users really appreciate our support. They enjoy having a Mila expert as their partner for their challenges, but they also feel more motivated and better equipped by the trainings and tools we're providing. And this you can actually also see by the great user rating we're having. So a 4.96 out of 5 and a great retention rate of 85%. As a B2B company, we're currently having a subscription-based model. So the company pays a fixed price per employee per month. And for the employee, the service is completely for free. We started off as a team of 3 co-founders, so Catalina, Jonas, and me. And later on, Rosanna joined as psychologist to drive the development of the product with us. We currently closed our first funding round with Atlantic Labs and some business angels. That's why we're also currently growing our team. And now we're together on the mission of creating a safe space for mental health at work. In order to reach the next milestones on that mission, we're mainly looking for 2 things. So first is motivated employees, and second is innovative companies. So if you know someone that is looking for a new challenge in development and sales operation, reach out to us. And if you know an innovative company that wants to change the stigma around mental health, you should definitely let them know about us. So thank you so much for joining tonight, and looking forward to great discussions afterwards. Thank you.
Thank you so much for sharing. Now, Corona's been quite tough on most of us. It's been surprisingly hard to work from home. I always thought it would be this big dream, but yeah, it's surprisingly tough. We saw a big uptake of people using your product due to Corona. Do you think that that's going to disappear, or what's your view on this post when, you know, let's say next year Corona kind of ebbs away and we can go back to work? What's it going to be like for you?
Yeah, that's an amazing question. Thank you for that. So if we could say that there's like one positive effect of COVID, that is that for mental health has increased massively in the society and also within companies. So more and more companies realize that it's an important topic, that it's a topic that my employees care about. And so more and more companies also appreciate that it's worth it to invest in the mental well-being of my employees. And as Ines said, currently we are super strongly focused on modern, innovative young companies, but as kind of the realization also goes into bigger companies, more established companies, we really believe that this, let's call it trend, will continue within the next years and also will be the case for companies. So we don't think it decrease after the crisis.
Now, it seems like you're only tracking mild psychological issues. How do you ensure that severe psychological problems that might come up during these sessions are being treated? And how do you train your Mila experts for this type of thing?
Good question. And that's also like highly important to us, like to actually also provide a kind of service in those cases. So first of all, like all our Mila experts are psychologists. psychologists, or they are trained and they know about more severe mental health issues. That's first of all. And then they can, like that, they can see if somebody needs more therapeutical support. So what they then do is they consult, educate the client, so to say, or the employee on what are the different options in Germany is to get like therapy. Second is they show them like what's the process actually in Germany, because it can be quite a mess and quite hard to understand where actually they can get help. This is second. And third is they support the employees in actually getting active and getting motivated to get help. Because like I think the average waiting time till somebody gets therapy is around 7 years. So we're trying to shorten that time by giving the support and giving the right education to the people.
Wow, 7 years is a long time. It needs to get a lot, I'm guessing, get a lot worse or more painful before a lot of people actually go ahead and do things. And in the meantime, they're suffering. So this must be great for the employers to kind of, be able to push them in the right direction a lot sooner. Now, how do you differ from other mental health solutions that are on the market?
Yeah, this is also super good question. And how we see it is that we see mental health as a spectrum from let's say from green, I'm doing super good, until red, I'm like really, really struggling. And currently in society, most of the time, we only talk about the red part about mental health. So these 15-20% of people who are like really dealing with severe things like depression or strong anxiety. And we are saying everybody is somewhere on that spectrum, and everybody should work proactively on their mental well-being. Doesn't matter if you're in the green part, you can work on increasing your resilience, you can work on how to deal better with stress, anxiety once it comes up, or if you're in the middle and you have an acute situation, you can also work, you should also work on your mental well-being. So what are we saying and what are we offering is that we want to have a holistic solution for your entire company, for all of your employees, and we are providing the right support. Doesn't matter where you are on that spectrum. And kind of to finish my sentence is here, and back to your question, that most of the providers out there are specifically focused on one area. So it's rather I'm focused on severe cases like classical EAP programs in workforces who are more like a crisis hotline. And on the other hand, you have like super low threshold, more like meditation, mindfulness providers like Headspace, Seven Mind, etc.
I like that holistic view. I think that really makes sense. Now, thank you so much for sharing. Thank you for pitching, and thank you for answering the questions that I had and the audience had as well. I really enjoyed tonight. I think it was such an amazing night. I hope all of the startups feel good about their presentation. I definitely do. I think they all did a tremendous job, and I feel like we deserve to, to celebrate a little bit. And since we're not all in the same room, we're going to have to be a little bit creative. So I'm going to ask all of the founders that shared in the session or in this evening to come and join us in the session, and share their webcam, share the pictures, and we'll all celebrate together. And I want to ask some other people as well, some of the organizers of this event, to come in to this session and and kind of show their faces, because we're going to be celebrating together. Now, let me see if she's here, but Maureen and Joshua, two of the amazing organizers in this event, are very competitive. That's one of the things that I should say, and a lot of the startups know this. And I want to kind of ask which bets have been going on in the background and who's won. Maureen, do you know?
We actually had some bets running, but in case you know us, we actually bet on everything. We started betting, by the way, in the beginning of this year, how many people would apply, and kudos to our program manager, Lucy, that won a bottle of champagne. We bet this year how many new participants we would have for the second batch that is going to start in January. Again, Lucy Avalanche deserves some French champagne, and we also had a bet running how many people would join. We had more than 200 people joining this demo day, so thanks a lot. We had a lot of people that registered, that read information beforehand, and we are not done here. I don't know how many meetings have been scheduled, but keep scheduling these meetings because it's extremely important to have individual conversations. We do online meetings. We actually have 180 online meetings each month now due to Corona. And next week we have already scheduled 30 investor meetings for the startups that presented. And I'm very distracted by Junaid, by the way, from Team Bioticore, that is really squeezing in some advertising. So you see, we also have a lot of fun. So I also want to thank a couple of people, if I can do that at the end.
Yes, please do.
First of all, Justin, it was such a pleasure. Thanks for joining us from Amsterdam. Next time we do it here in Berlin, and we are welcoming you on a real stage. You made the life of us and also the teams very enjoyable. It was a great 90 minutes. I also want to specifically thank everybody that prepared the teams for that occasion. Bianca Pretorius, Johannes from Plan D, and also Vidisha Bergler, our investor expert, and Ali Noizet that also set up all the meetings coming up next week. It's a lot of preparation time, and most of all, the person behind the virtual cameras, Joscha Hofferbert, that is in the studio, Lucy Avalanche that coordinated the Q&A, a lot of information coming in, and also Carmen, Paul, and Gemma McCreesh. Without them, it would have not been possible. We also have some other support, and it could be a long list. But without further ado, because we can't come all on stage and then do a final picture, I think there's another thought we developed, and I'm handing over back to you, Justin.
Yes. So the idea is we fill our glasses. I'm going to do that right now. And then I'm going to count down from 5, and we're going to celebrate. So 5, 4, 3, 2, 1. Cheers.
Woo!
Well done, everybody.
So, everybody's still alive? Thanks for a great night.
Oh my God.
Thank you.
Thank you.
It was so loud.
I hope in the next batch there is a startup that works with like tinnitus or like ear problems or something that can help us.
And there's so much confetti on everybody's floor and hair and beards and everything right now. Thank you so much for doing that. We're looking forward to chatting with you in a bit, because the one-on-one sessions are going to start any moment now. If you haven't booked any of the sessions yet, please do so below. You can still book some sessions. And thank you again for tonight. And yes, hope you enjoyed. We definitely did. And congratulations again to the startups for doing a tremendous job. Cheers.
Thank you.